Good afternoon, everyone. As we're still having people coming in and out of the building, I would just ask if you're patient with us. What's happening right now is Miss Tammy is passing around some materials in the room. Can you hear me? Can't hear me. Can you hear me now? All right. Testing 1, 2. Can everyone hear me better now? Awesome. Good afternoon. We're going to give these last minute folks the opportunity to come back into the room, and then we're going to get started. What's happening right now is you're receiving some information from the coordinated entry supervisor, Miss Tammy Byer. She is passing around materials, some information that we're probably going to go over today.
The idea that we still having to fight for our reproductive rights.
We're asking that HMIS please take care of muting people as they are coming in the room if you notice that they're unmuted. Thank you so much. It's fine. I have enlisted Miss Linda and Mr. Michael to help us with the mics. However, if we do have a volunteer from Opening Doors that can help, that'd be great. Good afternoon, everyone. Welcome to Opening Doors, Northwest Florida. Thank you so much for coming to the 2025 Point in Time Count Community Planning Meeting. We are calling this Point in Time Count 2.0, right? Because we had a winter storm that came into the area and really made our first attempt at PIT very dysfunctional, right? I took the time, reached out to HUD, we got an approval for an extension, so we get to do our point in time count for the first time ever in the month of February. Today, we have a jam-packed agenda. We are going to be going over some introductions, understanding what the point in time count is. We're also going to talk about some roles, responsibilities, volunteer and partner coordination, logistics, resources. We're going to have a short Q&A session, and then we are going to talk about some next steps in wrapping up. What I want to do first is let's go ahead and pass the mics around the room. If what I can have you do is please tell us your name and what organization with, and let us know if you are a PIT veteran or a rookie or first timer. Let's start with Claxton.
I'm Claxton. Excuse me, I can't talk. I'm Claxton Middleton. I'm with Children's Home Society, and I'm definitely a rookie.
Brittany Harris, Community Response Specialist with PPD, and this will be my second year, but I'm still a rookie.
I'm Keisha Langford. I'm with PPD also. I'm also a Community Response Specialist, and I'm a rookie.
Troy Watts, REAP Maxwell Respite Center, the program director, and I am a rookie. But I don't know, I was in the snow that day.
Linda White with Family Housing, and I'm a veteran, but no longer participating.
I'm Nancy Barrett with St. Vincent de Paul, and I am a rookie.
Dick Baker with REAP in the Maxwell Center, certainly a rookie.
Vinny Wibbs with Reentry Alliance Pensacola. At 80 years old, I have not been a rookie for a very long time.
My name is Gabrielle Francis. I'm with the Offensive Organization, and I am a rookie.
My name is Jasmine Rivera. I'm with the Offensive Organization, and I'm also a rookie.
I am Brad Bishop. I'm with Offensive, and I'm also a rookie.
Walter Arrington. I'm with NASW Florida Northwest Unit, and I am a veteran.
Tammy Byer. I'm the Coordinated Entry Supervisor with Opening Doors, and it's been a while.
Michael Goodman, just a private individual volunteer. I'm a Pensacola rookie, but I've done point in time counts in other cities.
Hi, my name is Gladys
To the
Scott.
area,
Hi,
and I
oh,
forgot what else.
hello, my name is Gladys Scott, and I'm with Sisters of Hope, and I'm also a rookie.
Oh, I'm a rookie.
Hello?
Hello?
Hold on, Miss
Could
Gladys
y'all
online. We're going to go through the folks that are in the room first, and then we'll come back to the people who are online to have you introduce yourselves. So let's continue through the room.
My name is Whitney Cook. I'm with the Gulf Coast Sexual Assault Program, and I'm a rookie.
Dana Winans, I'm with United Ministries and I'm a rookie.
Barbara Francis with the Her Foundation, and I am a rookie.
Jamie LaPointe, Lutheran Services, Florida, and I am a veteran.
Connie Bookman with Pathways for Change and the Homeless Reduction Task Force. And I'm a codependent on Rocky Harrison, who I walked around with last year. It was amazing.
Hi, I'm Jennifer Karen Seiji with AHF's HOPWA program, and this is our second year participating.
My name's Dave Pasquale. I'm with Community Health Northwest Florida, and I'm a rookie.
Hi, my name is Carmen Chandler. I'm with Gulf Coast Sexual Assault Program, and I'm a rookie.
I'm Lindy Ducker. I'm also with the Gulf Coast Sexual Assault Program, and I'm a rookie.
And I am Tracy Hodson with Favor House, and Favor House is a veteran. I am more of the rookie.
Okay, someone in HMIS, if you could please start helping us with the people who are online to introduce themselves. And what organization you're with.
Hello, my name is Gladys Scott, and I'm with Sisters of Hope, and I'm also a rookie.
Avalon Mallory.
Sorry, I apologize. I just had someone knock on my door and ask me a question. My name's Mal. I'm the resource manager for 211 Northwest Florida. And I'm going to go with sophomore to the point in time count. Not hugely new, but also not super familiar. So I'm excited to get more in depth.
Drayton Smith.
Hi, I'm Roger Coleman with Volunteers of America, and I'm a freshman.
Elizabeth Kissel.
Elizabeth Kissel with Escambia County, and I would say I'm also a rookie.
Haley from Overflow.
Hey everybody, Haley or Hale, Overflow Health Alliance Director of Operations. It's been a day. And I used to do this a lot a few years ago, so I guess I could say I'm a sophomore getting back into it, so getting a little rookie status a little bit. So excited. Hey everybody.
Rachel Burns.
Hello, Rachel Burns with the Homeless Reduction Task Force and the Mental Health Task Force. I did it last year for the first time, so still consider myself kind of a rookie.
Richard Lynch.
This is Richard Lynch. I'm Director of Operations at Reentry Alliance Pensacola. I'm a military veteran, but I'm more like a sophomore in this point in time count.
Tiara Piffins.
Tiara Piffins with Catholic Charities of Northwest Florida, and it will be my first time.
Okay, thank you. Thank you so much for everyone being here today. This is, again, jam-packed, and we got a lot of information to go over. Just because you are a rookie or a sophomore does not mean that you cannot participate in this event, okay? This is something that is so important to our community. It is probably one of the most important tasks that we have because it helps us to understand what is happening within our community with the people who are experiencing homelessness. So the definition of the point in time count, it is an annual survey that we are required to complete. This census survey is pretty much our way of collecting data on the people who are experiencing homelessness in our community. And usually we conduct it once a year again in the last 10 nights of January. However, this year we're doing it in February because we received that extension. And usually this is a 24-hour event. HUD does give us some leeway. So with our community, we're actually splitting our 24 hours up. The purpose of PIT, again, is to provide our community with the vital data that is needed for us to understand the trends, the traits, the demographics of the people who are experiencing homelessness in our community. And it is a federal mandate by the Department of Housing and Urban Development that all COCs across the nation have to do this census survey count. So PIT, why is it important? It is important because it helps to inform us of the data. What types of funding sources do we need to go after as a community? It helps us to develop our community-wide strategic plan and understand those trends that we need to address within the strategic plan. It helps us to advocate strongly within our community and also at the federal, state, and local levels for programs and services to be developed to address homelessness in our community. And it also helps us to improve our services and outreach to those who are most vulnerable and most in need. Who is included in the PIT count? People who are experiencing homelessness. The people who we are seeking are staying in shelter and transitional housing facilities. These are our folks who are staying in streets, parks, and other places not meant for human habitation. And it is also our folks who are staying in domestic violence shelters, cold weather shelters, and also other places that are not meant for human habitation. Our job during this time is to collect demographic information on the people who we survey. It helps us to better understand our community's needs. And so our job is to ensure that we inform the people who we're going to be surveying what's going on, right? Some key dates and timelines that you need to be familiar with during this PIT count. The night of PIT that we told the HUD for our new date is going to be February 26, 2025. Okay? So whenever you're going out and you're surveying, you're going to always ask folks, where did you sleep the night of February 26, 2025? We have to split our PIT count up. And the reason why we have to do this is because shelter in transitional housing facilities, which domestic violence shelters and cold weather shelters and hotels paid for by some of our nonprofits in the area, we fall under what's called the sheltered portion. We have to count who was homeless on the night of February 26th. So shelters, transitional housing providers, anyone that falls under the sheltered definition of our count has to count on the night of PIT because we need to 100% track where they're staying in the specific shelter, right? That's why it's important that we complete our shelter survey on that February 26th. February 27th is when we do our service-based locations count. This is most times where you're going to see our outreach teams and trained volunteers going to locations to count people where they are getting their much needed services. So when folks are going to the soup kitchens, going to do their laundry, going to go get an ID, visiting one of our local community clinics, this is the apt time on February 27th to collect that survey. If you are a provider who volunteers to be a survey location for this period, there's something special you're going to need to do. You're going to need to help us identify who was sheltered and who was unsheltered, because there's a chance that you could come across someone who is sheltered at a service-based location. So a part of your training is understanding what should you do when you come across a person in different living situations. We're going to relaunch an in-person training, and there is going to be a virtual option. On February 11th at 9 a.m., there's going to be a sheltered count training. Shelter, transitional housing, cold weather shelter, DV shelter, hotel, motel, paid for by a nonprofit or charitable organization or government assistance. It would be in your best interest to come to that training. The unsheltered group, so our street outreach teams and any volunteer that's going to go to a service-based location, such as Alfred Washburn Center, Bright Bridge Ministries during their soup kitchen feeding, Loaves and Fishes during their breakfast or soup kitchen feeding, Sharing and Caring. We need you at the February 13th meeting at 9 a.m. These training sessions are going to be recorded, and they are going to be posted on the COC website, the lead agency website. So data entry and reporting deadlines. We need all paper surveys to make it into either the Hyperion app or the HMIS system no later than March 3rd. The reasoning is, although we received this extension, HUD is still going to require the HMIS lead to deduplicate our data, check it for accuracy and completeness, and we have to submit it in a report to them by the submission deadline. That submission deadline is either going to be the end of March or the very beginning of April of 2025. The lead agency does have some follow-up actions and post-count steps that we would like to take. One is we would like to post the preliminary results by March 14th to the community to let you know how we have done. We're going to try our best to deduplicate and clean up as much data with those preliminary results. We are going to start our data analysis March 4th, and it's going to continue all the way up until we submit to HUD. We're hoping that we are earlier submitting this year. We plan to have an action planning meeting with this data and with this information within 30 days after we submit to HUD. Roles and responsibilities. We need people to fill in some roles for us in our community. Some of those roles are, you might just want to be a volunteer that helps to go to a service location or to an emergency shelter or transitional housing program facility to help with collecting surveys. You might want to be the coordinator at your site. If you're going to be the site coordinator, you're going to be working very closely with us here at the lead agency to get trained and get your volunteers trained. If you're going to be a survey location or just a service provider, you may be helping us to complete surveys out in outreach. You might engender your entire outreach team to participate in the count during the unsheltered portion. And as a community partner, sometimes your power of influence is getting information pushed to the community about this event, about the importance of the event, getting flyers out, and helping us ramp up volunteers. Volunteer registration. There is going to be a sign-up process. The sign-up process is going to be in job form. In this job form, you're going to basically tell us if you're a transitional housing, emergency shelter volunteer, or if you're going to be volunteering at a service location. We need volunteers with lived experience and diverse backgrounds. We may need people who can speak a second language, especially Spanish in our area. We also work with an ADA 504 coordinator to help us with our deaf and hard of hearing population. Specific volunteer needs, we need outreach teams, volunteers to count at the overnight shelters and transitional housing facilities, and we also need volunteers at the site locations. We need to ensure that you send your volunteers that are going to be at your sites or with your organizations to the training and orientation, because we're going to go over some very important information. Again, it's going to be in person and also a virtual option. And you can just watch the recording, but if you watch the recording, we're going to ask that you complete a quiz and that you complete a form that says that you affirm that you attended that training. And the reason why we do that is because when we do our federal reporting to HUD, they actually ask us about volunteer numbers. Did your number of volunteers impact your count? They like to know about changes in the volunteers. What I hope that you understand is that you as a community partner play a very important role in this process. We need you to help us with getting this information out to let people know that we're going to be surveying, because you may have direct connections with people who the lead agency staff or that service providers that don't go out and outreach have, right? You, especially our outreach teams. We need your help with locating individuals to be surveyed, especially those folks who are hard to find, especially our youth population and our reentry population are usually our folks who are most hard to find whenever they're experiencing homelessness. So we need people with those connections as a part of this process. We're asking all community partners to help us with the logistics and the outreach. So in your mind, always keep that we're going to be at very specific locations: shelters, transitional housing, street outreach, and service locations. I would like to illuminate, we did ask for rapid rehousing and permanent supportive housing providers to be on this call. The reason we asked for you to be on this call is because you may have folks that are in that interval period of transitioning from being in a homeless situation to where you help them to lease up and move into a housing property, right? So we need your help to survey those folks that are still searching for housing if they're in a eligible living situation for the PIT count. When you are a volunteer, we're going to assign you to an area. You're either going to be stationed at an outreach location or a service location. Areas can be high density or have a lot of people there. So we need your help with completing this form here. This form is a PIT survey and volunteer support form. It helps us to understand exactly if your organization is willing to be a survey location where we could send volunteers to count people who are experiencing homelessness. We also would like to understand what hours and what day and time is going to be best for us to have volunteers on your site. And we also need to understand your participant load, right? So how many folks do you have coming to your facility on that given day? And how many volunteers do you roughly believe you will need to survey during your census period? These census blocks are usually about 3 to 4 hours whenever we send volunteers to survey. And so take your time, and I'm hoping that you can get it in by February the 11th, because this is a very fast turnaround for this event. Take some time, complete the survey, because it helps us with the logistics of volunteers and learning what sites we need to place where. If you're going to be a shelter or transitional housing program that is in need of volunteers, we need you to complete this survey. It's on slide 19. You're going to get this slideshow probably before the close of business day today for you to revisit. We need also all of our service-based locations. So if you're a legal aid, a veteran services provider, a supportive services provider, a health clinic, every single service-based location in our community, if you are willing to be a survey location, use that QR code on slide 19 and complete it and let us know your needs. Again, it's helping us to coordinate volunteer need and materials. The materials that is going to come from the COC program staff are going to be flyers, survey forms, the Hyperion information. It's the information that's on your app that you use. The maps and area assignments, safety protocols and materials, and incentive care bags, which we still have a lot in the back. If you're not receiving this information, this means that you are not on the lead agency's listserv, or you're not connected to the county listserv, right? So if you're not connected to those two community resource notifications, you need to get tapped in to them. Signing up specifically for the COC membership is completely free, and it is open to all. The way that you can sign up to be a COC member is by using the QR code on your left. If you are an individual, you're not affiliated with any organization, you just want to get involved. And if you are affiliated with an organization, then you sign up with the QR code on the right. Talk to your leadership because you might already have someone appointed. So just make sure that you're having these conversations internally, especially for your organizational members. If you've been on the COC website or you've been looking at the notifications that have been coming out, you've already started seeing some of the forms that are important for you to use, such as this newsletter. This newsletter here can be posted at your shelters, local businesses, wherever people who are experiencing homelessness engage and go for services or just to do their day-to-day things. We just want to make sure that you get this newsletter posted everywhere in our community. This is both Santa Rosa and Escambia County, because we're also going to be surveying in Santa Rosa County. We actually have a dedicated outreach team for Santa Rosa County that goes out. I'm now going to take a brief break, and feel free to ask any questions. Let's have some discussion. Bring up things that you feel like we have not discussed logistically. Yes. So the question of Mr. Dick Baker is about those folks who we engage with during the point in time count survey period that are wary of participating in the survey or reluctant to participate. So during the PIT training, we will actually do some role playing to go over how do we get this information out? How do we encourage people to participate? So we will do that at the 2 training dates next week. Any other? Yes, Troy. Yes. Mm-hmm. Yes, it does make sense. So Troy's question is, has the lead agency considered doing a television or radio broadcast about this event? So the people who are experiencing unsheltered homelessness or sheltered homelessness know that we are coming out. Yes, we have. What we are generally doing is we are asking either some of our local government has been going on radio stations and getting this information out. I went on Sunshine's Corner last time. I don't know if I can get back on with Miss Sunshine, but I'll ask. And we can do a broadcast and see how we can get information out. We will also engage with Miss Sandra Averhart with WUWF to get this information out to UWF's students. If you have that power of influence, you can definitely work alongside us to talk about this event on radio broadcasts and television broadcasts. Because it is important. It is part of your charge as a COC member, is because you are helping as a part of the collective body to get this information out. Yes, sir. We are still giving out the incentive bags. The question was, are we still giving out the bags at the end of the event after the survey is completed? Yes, we are. That's okay. We're still going to give you more. There was a question that was asked, are we going to give more care bags? Because they gave out care bags on the original Night of Pitt. We are going to be giving out care bags to replace those. Yes, Mr. Michael, can you use the mic next to Miss Tammy there?
There we go. I think that's on. Given that most people here are affiliated with an organization, they probably map to a location that ties with their organization in a lot of cases.
Mm-hmm.
For those private individuals who are just put us where you need us, is there sheltered versus unsheltered where you need more help? Or as we're trying to find volunteers and we let them know other people, which one should they aim for? When will you be able to let us know that?
The best thing that we should do is to actually hold a separate meeting that is specifically for outreach coordination, so that outreach teams can come together and talk about what is their general route. And we would expect for folks that would like to be involved with the outreach teams to come to that meeting so that you can get partnered with, if you're a rookie or new to our community, you get partnered with a veteran outreach team. So that would be how we should handle that. So there's going to be some additional information that's coming out to have a timeline of additional dates of something that we need to do. One being the coordination of outreach, because we need that. Is there anyone in this room right now that would like to volunteer to help us with outreach coordination? If you have that extra time where you can come and work with lead agency staff. Okay, so we got 3 volunteers. All right. So if you can stay today, at the end of this meeting, I would like to get your contact information so I can get you on an email thread with our internal team. Okay. Thank you. There's questions online. Can I please get the support of HMIS to help us?
It wasn't really a question. I was just volunteering that I might be able to help with outreach.
Thank you, Ms. Haley.
Mhm.
Can you check the chat, Dan, just to make sure they're okay? Thank you. Any other questions internally in the room? So again, our next steps. One is let's get an outreach meeting planned, right? So we can get our outreach teams together. We also need for service-based locations, shelters, transitional housing facilities, or anyone that falls in the in-between that has people who are experiencing homelessness come to your facility on a day-to-day basis. Complete that survey that's on slide 19 by February the 11th. We have 2 training sessions that are going to come out. You're going to be receiving emails from the lead agency letting you know this is coming. I might become overwhelming to you. I just want to let you know it's me that's doing it. So community outreach is going to be important. So I need those people who are in positions of power, who, if your power of influence is to get this information out, this event that's happening We can only work and do what's best for our community if we work together, right? So I'm going to get information to you. Please help us push this information as far spread as we can throughout the community, even to the business leaders. Let them know that we're here. Let them know that we're strong. Let them know that we're united and that we're wanting to count people so that we understand what's happening within our community. Anything related to the point in time count for fiscal year 2025, please reach out to me. There's my contact information on bullet 1. Stay connected to what's happening with Pitt 2025 by going to these 2 links here, the collaboration page for Pitt, and also on our homepage. As soon as you land, everything that's happening with Pitt is right there on that landing page. Thank you so much for coming to this meeting. 850-466-5379. You're welcome. Yes, ma'am. Eight 850-466-5379.
Hi. Could you post
I'm
those
personally-
links
You might
in
have
the
my
chat?
personal cell if you're like on a one-on-one basis with me.
Hello, everyone. I'm Serene. I want to personally thank you all. This is an amazing crowd that we got today. I think you should be excited about what we see here today because this is what I call it the Pitt Count redo. They call it the Pitt Count 2.0. So we're redoing it and we're going to do it better. I want to shake you up a little bit. I want to start you out because, first of all, are you all members? Yes. Okay. And I realize we'll probably got to do some badges. If you're not a member, just scan off back as you go through to become a member. If you are a shelter, I want you to stand up right now. If you're running a shelter, stand up. Come on, Her Foundation. Okay, transitional house. Okay, let me, no, keep standing up. Jamie, stand up. Transitional house, emergency shelter, permanent supported housing. Stand up. Perfect. Now, tell me your shelter. Okay. And it's from Santa Rosa family. Okay. Okay. And transitional housing REIT and emergency shelter. Empower. Okay. Offensive transitional REIT does it all. Her Foundation, transitional, Lutheran Services,
Basic Center, emergency shelter.
Favor House, domestic violence shelter. Okay, now I hope y'all listened to who's here because who's not here, you're members of the continuum of care. This is just not on staff load here. Okay. If you're familiar, have a relationship with the people that are not in this room today, they need to be in this room today. Okay. This isn't supposed to be a completely COC staff objective. It's COC members and people who serve the people in our community. I'm not going to call these people out because instead I'm going to applaud the people who are here. But if you know the people that aren't here, reach out and say, hey, I was in a room full of, what do we got here? 30 people here at least that are compassionate about finding a good number for our community. Compassionate about giving good reports so we get more funding. That's what you all did today. Okay, now, mobile outreach teams, street outreach teams, you stand up. Stand up. Mobile outreach. Now you don't go out mobile? Okay. If you do that too, do that. Okay, now we have a little bit, now we still do mobile outreach instead of. Okay, perfect. And we have beautiful city Pensacola ladies here. And we have Empower also does. And Children's Home Society, Street Solutions, Street Outreach, perfect.
Well, NASW here.
Okay. Offensive in the house. This gentleman back and Opening doors.
Opening doors, and as soon as we can hire more people.
Yeah, we need more. We're hiring. We're hiring, folks. We got 2 positions that we're hiring for. And yes, sir.
Community Health Northwest Florida.
Okay. Wow. Now that's impressive. Okay. We've almost got it covered, but there's a few out there we need to reel in. Okay. But that's very impressive group here. I'm so proud of y'all for all coming together. Once again, pull in. Now, who's the volunteers, the private citizens? Stand up. Come on, Mike. Wow. That's a good percentage. Miss Connie? Private citizen or you? Okay, private citizen. You don't run a street outreach or not running? Yeah. Well, I know, but I'm trying to make a percentage here. So you, private citizens, your job is to get more private citizens, more volunteers. Okay? Yes, that's your job. Everybody's got a job.
And I would just like to say
Yeah.
that we can take 18-year-olds, 18 to 24. This is something great for our youth that are going to Pensacola State College, going to UWF to get involved in, especially if they're going to go into social work or psychology or even, data and IT. So this is a wonderful event to get our younger population who may have some lived experience or who don't, who just are passionate about homelessness to get involved. So our volunteers can be as young as 18.
Hey, Martika, can you hear me?
Just a moment, please, online. I got you. So what we usually do is we cast a wide net with Constant Contact and with the COC website and with the county's listserv. We also reach out personally to UWF for volunteers. We've had 2 classes. It's usually the nursing students that get very involved, especially with this event. We have historically had social work students. This year, I think timing just didn't help out with everything. I'm hoping we can get the social work students back involved since we've switched the pit count to February to get them involved for this period. So if you can help us with that with Dr. Hoffman. Yes, please. Thank you.
And she mentioned NAS. Anybody have a good NAS strong connection? You'd like to contact NAS? You want to do NAS? Okay, now we're cooking. Okay, now we're cooking. That's what we got to do. Okay, anybody that got a strong connection to Pensacola State College?
I
Okay,
can connect. I can
pass
connect
the
you with
word over.
PSC.
Rachel Burns is online. She says she has a connection as well.
Okay, it doesn't matter if 2 of us call, y'all. It doesn't matter if 3 of us call. Okay, is it me? No, we don't want confusion, but we want them to know, hey, there's a need.
So we can help.
If the same message is the same, you go to the same place to sign up to be a volunteer.
We can help you with crafting language. We can get you a flyer in hand. So that way that reduces the confusion. So that we all use the same messaging, right? Because we're one band, one sound.
Okay. And did we mention that we're hiring for another outreach? And this is most exciting. If you don't like to do outreach, this other position is the decentralized coordinated entry staff person that we're going to get hopefully permission from our shelters like REAP, Waterfront, Bright Bridge, and they will go to your shelters once per week and make a little room for them, a little space for them. And they come see y'all. ID assistance for birth certificate assistance, sort of take some strain off of your staff. You were. Oh, Gabby, I know what you're doing. Okay. So we're looking for a position that will be decentralized coordinated entry, no wrong door. They will rotate shelters, not out in the street, but sheltered. Okay. To try to find out who's possibly ready for rapid rehousing, how to get them ready for rapid rehousing, what barriers do we got to remove? Is it state IDs? Is it birth certificates? Is it connecting to a workforce? You know, is it to connect them to Social Security? She's got the application over there. So if the street isn't your gig, but you still want to help, and you want to be able to be moving about where every day is a different day in a different location. Every day you wake up to a different day. It's a job for you. Okay. Okay.
So, Ms. Ring, can I ask, there was someone online, we had to have a pause when Ms. Connie Bookman was asking her questions. Could you please come off mute and ask your question now if it's not been answered?
Yeah, I was just gonna ask about the Pensacola State College has a career fair coming up. Is there a presence there for opening doors and the point in time count?
If you can send that information in the chat, we'll see if we can get someone out there to go and be a voice to pass this information around. And thank you so much for bringing that information up. But no, we don't, but we would love to. And what was your name?
John.
I think I met you. I remember, John. You came to a
Yes,
meeting
ma'am.
here.
We
Yes,
met
I remember now. It's nice seeing you again.
Yes, ma'am.
Any other questions that we have? This is all good information, good way to help each other. Anything else? You're welcome.
How about a group picture?
Okay, if you don't mind having your picture taken I would like for us to have some type of picture, at least for when you volunteer for this event. It would be great for us to do like a uniform picture. Say, hey, I volunteer for 2025 point in time count. So can we do that towards the end of PIT? Like we just come back to the hub, do it now? Okay. All right. Okay, that's fine. That's fine. Let's do that now, I guess. Unfortunately, our folks online can't be in the, well, you know what? Let's put the gallery on. Right in front of Mondo. If you don't mind being in the picture.
You might get more, I don't know how you have it set up, but we're seeing the screen, the PowerPoint. You might get more people on the screen if you aren't sharing that.
Hi, folks online. We're going to be taking a picture. The session is being recorded. And if you would not like to be in the picture, please make sure that you turn your camera off. That way, you're not on camera if you don't want to be. Thank you, everyone online. The meeting is adjourned. Thank you so much for coming today. Thank you for your continued partnership, and we look forward to seeing you during the point in time count events this month. Have a wonderful afternoon. Hi, Mr. Roderick. It's nice to see you. It's been a while. Dan, can you please make sure to stop the recording? All folks who are online, we'll need you to sign out for our recording to save. please make sure that you completely leave the meeting so that our recording stops. Thank you so much.